Hi, this is video 2 out of 3, so listen to this 1 second. We're looking at respiratory muscles and additional muscles that we use to breathe, and we're going to briefly look at minute ventilation. So what do we need to know? We need to understand that the body requires extra oxygen when we're exercising, and it also needs to rid the body of carbon dioxide. The carbon dioxide is produced when we produce more energy for muscle contractions during exercise. We need to look at the medulla oblongata and how it distributes its information from the chemoreceptors, so the initial information it collects from the chemoreceptors in the arteries, to the respiratory control centre, and thus the inspiratory control centre and the expiratory control centre. If you're still unfamiliar with those terms, have another look at video 1, please. We then look at, or need to understand, that the phrenic nerve transports this message as an electrical impulse down to the diaphragm and to the intercostal muscles, and contraction occurs. Inspiration will result and expiration, although this only happens when exercising, and that is what we're learning about today. So the muscles involved in breathing. First of all, these are the terms that you need to know. You'll notice there's no distinction on offer today, and that's because this is more anatomical. This is learning about what's in place and what moves, rather than how it moves and why it moves and what impact that has. So it's a bit simpler, so there's no distinction. So we need to know the term external intercostals. We need to know where they are. We need to know the internal intercostals, what they do and where they are. We need to look at what the diaphragm is, what it looks like and how it moves. We need to learn to say, and that is important, just keep saying it to yourself over and over again, the sternocleidomastoid and mastoid. I will go over that and slower for you later on. The rectus abdominals, the oblique abdominals and the transverse abdominals. We will learn where all those muscles are and you will practice saying them. So first of all, let's look at the external intercostal muscles. They are used for inspiration, breathing in. So the way I like to remember this is, if we have got external intercostals, they're used for inspiration, inhalation. If we've got internal intercostals, they are used for breathing out. So internal intercostals are used for expiration. So X goes with in and in goes with X. Nice and easy to remember. Where are they? We will look at a picture of this in a minute, but the external intercostals lay on the outside by the ribs, and the internal intercostals are on the inside layer between the ribs. The diaphragm, we will see in a moment, is a dome-shaped muscle that lays at the bottom of the lungs, around here. It seals what we call the thoracic cavity, and the thoracic cavity is all of this area now shaded with the highlighter pen area. So this is the diaphragm. This, you can see here, look, it's a beautiful diagram, this one going up. And this is its relaxed position, which looks very odd because that's what it looks, or you would think it looks like contracted, but it's not. That's relaxed. And if you can see up here, this doesn't leave much room for your lungs. So when this is relaxed, it must mean that you've breathed out all your air. When the diaphragm contracts, it actually flattens and goes along here where I'm drawing the line now. Which means if this muscle has gone downwards, we've got plenty more capacity to draw air in. So when it contracts, we inhale and fill up our lungs. When it relaxes, it pushes the air out. And this is a common mistake that a lot of people make. We are talking about air and pressure of air, not oxygen, not CO2. They are gases that make up air, but they are not the air themselves. So these are the intercostal muscles, and you can see these by the ribs, and they move the ribs. And we've got the external intercostals on the outside, the external layer, and they work to lift the ribs up and pull the ribs out. So their job is to lift up and out. It increases the thoracic cavity, so this whole area, and if it increases, it means it can draw the air in. So it is for inhalation. The internal intercostals lay in the opposite direction, and they're on the inside. So they're internal muscles, but they lay next to the externals, but in the opposite direction, as I said. Their job is to pull the rib cage down and in. And if you're pulling the rib cage down and in, you're creating less space for the thoracic cavity, and therefore air is pushed out. So what happens at rest? Let's have a look. When we inhale at rest, we get messages via the phrenic nerve to contract the external intercostals and the diaphragm. So the diaphragm goes flat and the external intercostals lift and bring out the ribs or the thoracic cavity, thus allowing air to come in. So we've got the diaphragm contracts and flattens here. For exhalation, there's actually no messages sent. There isn't anything for the medulla oblongata to do. It doesn't send a message. We use the weight of the body to push down the ribs. So these muscles, your skeletal muscles here in your shoulders, in your chest, and your general weight just pushes these out because there's no message for the external intercostals to be working anymore. So they just relax and the weight of it pushes those ribs down. As the ribs push down and the diaphragm is no longer getting impulses to contract, so that also relaxes and goes up into its dome shape again, you can see our thoracic cavity is reduced. If the thoracic cavity is reduced, then it's going to push the air out. And that's how we exhale at rest. So it changes during exercise. Inhalation is generally the same. The external intercostals lift the thoracic cavity, lift the ribs up and out. The diaphragm flattens as normal, but now we've got extra muscles, and this is the one we need to learn. Stern, O, cloid, O, mast, oid. Sterno, cloido, mastoid. Sternocleidomastoid. Maybe play that bit a couple of times and talk over the top of me. No one can hear you until you get it. If you can say it, you will be able to write it in your exam. You're not going to lose any direct marks if you get the spelling wrong, so don't worry about that. Just do the best that you can. So we do use additional muscles in this case, and we use the sternocleidomastoid and mastoid, and these help to lift the rib cage out further and faster, because that's really important. The rate of the message from the medulla oblongata has now increased because we need to breathe faster. Our breathing rate must increase when we're exercising, and so must the depth of breathing as well. So we can essentially increase the amount of oxygen that we take in and decrease CO2 in our blood, as in exhaling. If our breathing rate is increased, if the messages for the external intercostals to contract has increased, and this is lifting more often, and now we're using these external muscles as well to help us do that quickly and efficiently, we can take in more air. We can take in there or absorb more oxygen, and we can diffuse out more carbon dioxide. So now we need to exhale. If we just inhale quickly but we don't exhale quickly, then we will be breathing in and out slowly. Breathing in deeply and out. I know that must sound very, very strange without seeing me. So we have to force exhalation as well to allow the inspiration to happen quickly. So now a message is sent from the medulla oblongata, from the expiratory control centre. So before we didn't get a message at all. The expiratory control centre didn't have to do anything at all. So now the expiratory control centre says we need to exhale. And what it does is it will send it through the phrenic nerve to the internal intercostals. So now we're getting a message to these internal intercostals here, and they are pulling those ribs down and in. The diaphragm does not get a message sent to it, but that will return to its relaxed phase. But this is moving quicker now. This isn't just the relaxation of the muscles as it was in rest. They're now being forced inwards. These guys, to exhale also uses additional muscles. And they've been nipped off the end there. But this is where your rectus, abdominals, your oblique, abdominals, and your transverse abdominals all come into play. So these are here, here, and here. And they will help, when contracted, to reduce the size of that thoracic cavity quickly and effectively to push the carbon or the air out, which allows us to get rid of the carbon dioxide. And if that happens quicker, we can then start the process of inhalation again and get the external intercostals working fast with the sternocleidomastoid, bringing it out to increase the thoracic cavity to draw the air in. And this can then happen faster. So let's just have a look and see, or just review what happens. So we've got messages coming up from the chemoreceptors to tell us that there has been an increase in CO2 because the chemoreceptor has detected a reduction in pH. That reduction in pH might also be to do with hydrogen, but that's covered in video 3. So this message goes up to the medulla oblongata, and then it comes down into the ICC, the inspiratory control centre, and we get messages to the external intercostals to inhale. If we are at rest, no messages are sent to the ECC. If we are exercising, then we do get messages to the ECC, and they send messages down to the internal intercostals to contract and lower the ribs to force the air out. When we're exercising, we always use the additional skeletal muscles, which were the sternocleidomastoid, your rectus, oblique, and transverse abdominals. Here they are, as a much better picture than the one that I drew. So we've got your obliques down the side. Your transverse actually sort of sits underneath those. It says here, look, sits underneath the 3 other muscles, and they go across like this. And your rectus abdominals is your 6-pack down the middle. So we now need to quickly look at volumes of air. We've got something called tidal volume. So tidal volume is the amount of air that goes into the lungs during inspiration and expiration. The average amount of a person is 0.5 litres at rest. That you need to remember. During exercise, because the depth of our breathing increases, we can actually take in up to 3 litres or more of air. Again, I just need to stress this is air, not the gas of oxygen or the gas of carbon dioxide. It's air. So tidal volume, you may have seen something like this called a spirometer graph. And if I was to be breathing in, it would read how many litres I've just taken into my lungs. If I breathe out, it reads how many litres I've breathed out of my lungs. Breathe in, out. Breathe in, out. Now, if I exercise, and this is going to sound strange, I'm going to breathe deeper and faster. The depth is shown in the height of the graph, and the frequency is shown, because that also increases, when they get closer together. And this is called a spirometer. Spirometer. And that's a spirometer graph. And this is showing tidal volume, the amount of air you're breathing in and out. This shows the frequency or the breathing rate. Now that, and you can't count it yourself because it's controlled by you, it's voluntary and involuntary, so you can control it. It often changes when you're trying to count your own. But I say the breathing rate is 12 over 1 minute. That's your breathing rate. So minute ventilation, this snazzy word that we've got here, is all it means is the amount of air that we ventilate, that we breathe in 1 minute. So that is worked out as breathing rate, 12 times per minute. Tidal volume, the amount we can breathe in and out, is 0.5. And that means minute ventilation is 6 litres in total, 12 times 0.5.